Wouldn't it be nice if everyone you cared for had perfect teeth? Or if you didn't need to deal with taking dentures in and out? Or if we didn't have to worry about swallowing problems? Welcome to Part 2, Beyond the Basics. In Part 1 of this module, you learn basic mouth care techniques. Now we'll look at special situations you might see, like dentures or partial plates, or missing, loose, and broken teeth. We'll also talk about how to provide mouth care to people with swallowing problems, tube feeding, and on isolation. Let's take a look at some of these situations now. We'll focus first on denture care. I'm sure you know that many people wear full dentures. It's important to clean them every day because they can grow bacteria and yeast, and once the bacteria and yeast are on the dentures, they can infect the gums and cause infection. To clean someone's dentures, of course you'll wear gloves. Besides that, you need a soft toothbrush and running water. You'll also need a denture cup, preferably labeled with a person's name, that you can store the denture in. To clean their gums, you'll need gauze pads and a liquid such as water, Biotene, Listerine, or chlorhexidine. To begin, greet the person and ask to provide care as usual.
You want me to get your dentures and take them and brush them for you?
Then, ask the person to remove their dentures and place them in the cup filled with clean water. If the person can't remove the dentures themselves, ask them to open their mouth so that you can remove them. It's important to remove dentures properly so you don't hurt the person or damage the dentures. To remove upper dentures, grasp them with your middle and index fingers behind the front teeth and your thumb on the outside of the front teeth. Gently rock the denture back and forth, front to back and side to side. When you feel the denture loosening, pull it down and towards you to remove it. For dentures that are a bit looser, it's often easiest to curl your index finger behind the back of the denture, place your thumb on the bottom of the teeth, and then gently pull down. Let's see how easily this can be done with the right technique.
Okay, I got one side loose. Okay, here we go. All right, thank you.
To remove lower dentures, grasp the middle of the bottom teeth between your thumb and middle finger and gently rock the denture back and forth. Once loose, pull the denture upward and towards you to remove it. After you remove the denture, put it in a cup filled with clean water. Now that you've removed the dentures, you're ready to clean inside the mouth. For this, dip a piece of cotton gauze into the liquid cleaning product you're using. Here, the caregiver is using chlorhexidine. Squeeze out the excess liquid, wrap the gauze around your gloved finger, and rub the gums, insides of the cheeks, and under the tongue. Use a gentle sweeping motion to remove food. It might be necessary to use several gauze pads if there's a lot of food in the mouth. As you're cleaning the gums, let the person spit into a cup if they need to.
Just relax, sweetheart.
Next, it's time to clean the dentures. Let's watch one aide clean a set of dentures. First, she places a paper towel over the drain to keep some water in the sink. This helps keep the dentures from being damaged if they accidentally drop into the sink. Then, she takes the lower denture from the cup and brushes it using the same jiggle sweep motion we use to get the plaque off the teeth. As she brushes, she rinses the toothbrush and denture under cool running water to remove the loosened food and plaque. It's also important to clean the other surfaces of the denture besides the teeth. Here, the aide is cleaning the inside surface of the denture. It's really important to clean the part of the denture that contacts the gums. This is a common place for food to get trapped. It's also where the most bacteria and yeast grow, which can cause painful problems if it results in swollen and infected gums. You'll also want to clean the biting surface of the teeth, since food can get trapped in the crevices. Now the lower denture is clean. So rinse out the denture cup and put the clean lower denture back in it. Now let's clean the upper denture. Here we'll see a similar approach. First, the aide cleans the teeth using the jiggle sweep technique. Next, she uses the brush to clean the smooth surfaces of the denture. Now we see her cleaning the part that contacts the tissue in the person's mouth. She's cleaning out the adhesive, food, and plaque that have gotten trapped in the ridges of the denture. And now with the upper denture clean, The aide places it in the denture cup and fills the cup with cool water until both dentures are wet. There are a few other important things to know about caring for dentures and gums. First, you should never use toothpaste because it will scratch the surface and leave grooves where bacteria can grow. Second, before you put the person's dentures back in, it's a good idea to check for redness, swelling, or irritation in the gums and other areas that are touched or covered by the dentures. Irritation may be a sign that the dentures aren't fitting properly. If you see a raw area or ulcer, tell a medical professional who can decide whether the person should see a dentist. If you don't notice irritation, gently replace the dentures in the mouth. Here's another interesting point. A lot of people use too much dental adhesive. If dentures fit well, they usually don't need any adhesive. If someone's dentures do require adhesive, use as little as possible.
Right.
Finally, another thing to keep in mind is that dentures should be kept out of the mouth for at least 4 hours a day, and preferably more. The tissues in the mouth need to be exposed to air to breathe and stay healthy, and that's not possible if they're always covered by a denture. Think about it. Is any part of your body meant to be covered by plastic 24 hours a day? To be sure the denture is removed regularly, it's easiest to take the dentures out before bed each night. When they're out, keep them wet by soaking them in cool water or denture cleaner. Otherwise, if they dry out, they can change shape and stop fitting well. Also, be sure you store the denture out of direct sunlight and away from heaters because heat also can change the denture shape. Now let's talk about partial dentures. People who have partial dentures have some natural teeth and a removable appliance that attaches to the teeth. Each of these appliances is different, but they all come out by unfastening a metal clasp. What I mean is that every partial denture has a metal clasp that fastens it to the teeth. To remove the denture, grip the clasps. Work them gently until they unhook and the denture is easy to remove. If you're not comfortable removing a partial denture, ask someone to help you. When the partial denture is out, you'll need to care for it as well as the remaining teeth and gums, just as we showed earlier in this module. To clean the partial denture, first brush it with a toothbrush soaked in cool water. Rinse it under cool running water while continuing to brush away food or adhesive. Then replace the denture in the mouth. Like full dentures, partial dentures should be kept outside the mouth in a cup filled with cool water for at least 4 hours each day. Now that we've talked about dentures, we can move on to other special situations. The first is that some people don't have any teeth. This situation is identical to people who have full dentures, in that the gums still need cleaning so bacteria and plaque don't build up and cause inflammation, bleeding, or infection. Gums should be cleaned daily by rubbing them with a finger wrapped in gauze and soaked in a cleaning product such as water, Biotene, Listerine, or chlorhexidine. As always, be sure to carefully remove food from inside the cheeks and under the tongue. Other people you care for may be missing only some of their teeth. If so, you'll need to care for both the remaining teeth and the exposed gums. For the teeth, clean as we discussed earlier, and care for the gums as you would for someone with dentures, using a gauze pad soaked in your cleaning product. Another common situation is loose teeth. They're important to identify because very loose teeth can fall out and be swallowed or even inhaled into the lungs. So if you identify a loose tooth during mouth care, notify a medical professional. If it's safe to provide mouth care when there are loose teeth, keep in mind that even gentle touch and movement may be painful. With this in mind, steady the loose tooth with your other hand and use short, light strokes when you brush. If the loose tooth is next to other teeth, hold it steady when you use the interdental brush to clean in between the teeth. Here's how one care provider used gentle pressure with the interdental brush to clean around a loose tooth. If a loose tooth falls out during care, keep it out. Apply pressure to the wound with clean gauze to stop bleeding and notify a medical professional. Another common situation is when teeth are worn or broken down so far that all you see are little bits of tooth sticking up from the gum or that are almost level with the gum. These broken teeth are sometimes called root tips. And although you might not think so, they're especially likely to trap food and cause gum inflammation. To clean broken teeth, use a cotton swab, not a toothbrush, because a brush will scratch the surrounding gums and may be painful. Dip the cotton swab into your cleaning product and then rub it around the broken tooth, removing plaque or debris. If you apply a fluoride product at the end of mouth care, treat the broken tooth just like any other tooth. Apply the fluoride product along the gum line and to all exposed surfaces of the broken tooth. Our last 3 situations are somewhat different. We'll talk briefly about people with swallowing disorders, on tube feeding, or on isolation. We'll start with swallowing disorders. Some people have difficulty swallowing, perhaps because of weak muscles, damage from a stroke, or some other medical reason. For them, be sure to provide mouth care sitting up, since it's more difficult to swallow when lying down. Then, when you brush their teeth, do not use toothpaste. Foamy toothpaste or even too much liquid is especially wrong for these people because it can cause them to cough or choke. Instead, use one of the other cleaning products like water, Biotene, Listerine, or chlorhexidine, and use just a little bit. Dip the toothbrush in the liquid and then dab it on a gauze pad to get rid of any extra. Then brush like you normally would. As you brush, be sure to ask the person if they need to spit, and if they do, give them a medicine cup to spit in. If the person has natural teeth, you can still apply the fluoride product after you've brushed the teeth. Just be sure to use a small amount. Our next special case is people who are on tube feedings. Even though they may not put food in their mouth, they need mouth care because they still have bacteria in their mouth. And also, they'll feel a lot better if their mouth is clean and fresh. Keep in mind that people on tube feedings often have trouble swallowing, so you should usually treat them like someone with a swallowing problem. Sit them up if you can. Use one of the liquid cleaning products and use just a little bit. You may find that someone on tube feeding has thick mucus inside their mouth, and if so, use a finger wrapped in gauze to remove it. Other than that, give mouth care just as you would for anyone else. Our last special case is when someone is on isolation. Although their mouth care is the same, you'll want to take a few extra precautions. First, you'll need to wear a gown and mask. Second, you'll need to set up your supplies outside the room. If you don't, and if you take a tube of toothpaste or something else with you into the room, you may very well carry their infection to the next person you care for. So here's what to do. Get all of your supplies ready outside of the room. Then, take only the supplies you'll actually use into the room, and discard of them in the room when you're done. Also, be sure to disinfect yourself after you provide mouth care. That's it! You've now learned mouth care basics, good mouth care based on proven best practices. Now that you've learned these different techniques, you'll want to practice what you've learned with the people you care for. Choose someone you know well and who you expect will cooperate. As you're providing care, think about what you find easy and difficult, and also consider what aspects of care might be challenging if you were providing care to someone who wasn't cooperative. Before you practice, you may want to print and review the Mouth Care Basics worksheet in our training materials. Thank you for watching. You can obtain 1 hour of continuing education credit for this module by printing the Module 1 evaluation form from this DVD or our website, completing the form, and mailing it and the processing fee to the address on the screen. Thank you.